Low vision. What is low vision, and do you have it? Well, I'm Dr. Ed Huggett. I'm an optometrist. I practice strictly low vision, vision rehabilitation services. A very focused, no pun intended, very focused area of optometry and eye care that is very relevant, very helpful for a lot of people that have vision impairment. So what is low vision? Well, low vision, the technical definition, if you look it up, most times you'll see 20/70 vision or worse. Sometimes you'll see worse than 20/70 vision in your better eye. And what does 20/70 mean? Well, 20/70 means what I with normal vision could see 70 feet away, you could only see 20 feet away, 20/70. And that's with your better eye. So if you have that, certainly you're visually impaired. But I expand that definition out quite a bit. Where I go with that is the Academy of Ophthalmology, or American Academy of Ophthalmology's definition of vision impairment and low vision is if your better eye sees worse than 20/40, so that's your better eye worse than 20/40, which means what I could see 40 feet away, you could only see 20 feet away. And by the way, 20/40 is about half as good as normal. So a person with 20/40 vision or worse, they are starting to struggle from the time they get up in the morning till the time they go to bed. They're struggling with their vision and just doing their activities of daily living that they do during the day. So that's one definition. Low vision, worse than 20/40 in your better eye, or, and I'm going to underscore the word or visual field loss. So if you have a loss of your field of vision, so your field of vision is everything you see with each eye, and then in totality what you see with both eyes. If you're having trouble, say, with glaucoma and you have peripheral vision loss, or if you have trouble with macular degeneration, you have that central vision loss, that right area right in the middle. And that area in the middle of vision loss may not look like a big black hole. It may look like just a blurry area that when you try to read, things are popping in and out of view, and sometimes you see the word, sometimes you don't. That is a visual field loss. And sometimes you can have visual field loss due to head trauma, like a head injury, a stroke, where you lose half the vision in each eye, called a hemianopsia. So you could lose half the vision of each eye on the one side or the other side, and it's called a homogeneous hemianopsia, and maybe your neurologist has diagnosed you with that. There's a lot we can do with any one of these things. So visual acuity less than 20/40 in your better eye, or visual field loss of any kind, or, again, underscore or, you have decreased contrast sensitivity. And what is that? Contrast sensitivity is the quality of vision where how much contrast you need to see something. If you remember back years ago when we had TVs, we could adjust the contrast. You could make the contrast high or low, and you can even do that on some video cameras today. Well, low contrast is where maybe you have a green print on a blue background. That's low contrast. Or you have a black print on a gray background. That gives you the idea of low contrast. That's a quality of vision. And some people need higher contrast. And where that'll come into play, especially people with diabetic retinopathy or macular degeneration, glaucoma, various other things, they'll need more light. They say, I just need more light. They want to get out into the sun, get more light. That's usually due to a lower contrast sensitivity. And that causes you to need more light, causes you to need more magnification to what most eye doctors would measure, and also causes you to have difficulty seeing details. And details like seeing faces, being able to read, judging depth, going up and down curbs and steps so that you're more likely to fall. And that's part of the evaluation we do. Evaluate all these three things. We're looking at visual acuity, contrast sensitivity, and your field of vision loss. And there's a lot can be done with that. And I'm going to put in another video how we adjust to, how we address those three different areas of vision loss. But that gives you an idea if you're a candidate for vision rehab. If you're having trouble seeing something, even with your best pair of glasses on, you're probably a candidate for vision rehab, because what I do, this is the key, I find out what vision you have and what I can do to make it better. So give me a chance to do that. It takes about an hour. By the end of the hour, you'll know exactly what I can do for you, and I'll be able to help you. And if I can't help you, we don't charge anything out of pocket for a patient, so there's a very low risk. But I do look forward to seeing you if I can help. Call me if necessary. We do free telephone consultations for a half hour. I'll give you all that time. Love to answer questions you have, discuss with you your condition, and see if we're a good match. I'd love to help if I can. Until next time, give us a call.